Hello, I'm Dr. Andrew Heyman, Fellowship Director of Integrative Medicine at George Washington University, and I'm delighted to be here with my colleague, Richie Shoemaker. Dr. Shoemaker, I'll have you introduce yourself.
Good afternoon to you, Andy. It's a pleasure to be seeing you long distance. I understand you're living in New Zealand now, place of the Garden of Eden. It sounds fabulous.
Yes.
I'm back here in Pocomoke, Maryland, where I've been since 1980. And since 1995, my passion has been environmental illness causing chronic fatigue illnesses that get misdiagnosed all the time. And I've worked with Andy and others for years and years and years and published a textbook and written, I guess, 60 papers and 15 books. Between Andy and me, I think we probably have close to 500 lectures that have been given one at a time or another. But we're here today to talk about climate change and its role with indoor human health. What effect is there from increased floods? What effect is there from increased water intrusion? We're going to use a definition that's broadly accepted that gives us a scientific understanding of climate change as long-term shifts in temperature, precipitation, humidity patterns, and frequency or intensity of extreme weather events driven largely by changes in atmospheric greenhouse gas concentrations, that would be CO2 and methane and others, and broader Earth system dynamics. Sounds like we're biting off a lot to chew, Andy. I've got a lot to say about building health, and so do you. So why don't you tell us how we associate climate change with sick people?
So I think that there are a number of areas to consider when you think about climate change. And certainly one is extremes in weather systems or patterns. And that means more intense rainfall, which might also intermingle with longer periods of dryness. But we know a few things about the direction in general of the climate. The first is that humidity in general is increasing. And this tends to occur, of course, more so near or over bodies of water. So cities along the coast or closer to the equator, on average, are experiencing higher levels of humidity. In addition to that, for every degree of increase in the climate, you have an additional 7% increase in water content in the air. So it's not insignificant to worry not just about flooding issues, but maybe one of the biggest culprits will be exposure to humidity and a higher heat index as a result of that. We always worry that 60% or more of a humidity can potentially on its own lead to microbial growth in the home.
We worry so much about water intrusion and mechanisms of intrusion. For years, the question has come up, where's the safest place to live? Is it safer in a desert or safer in the Pacific Northwest? And the answer used to be that anywhere you live that has indoor plumbing and has a roof or a basement or a crawl space is likely to have moisture problems indoors. But now, if you open the windows in Florida, you're going to have a growth medium in your living room without having any leaks or not having a roof blown off in a hurricane. So that this variable of excessive humidity penetrating the envelope of the building is new in many ways to what we think about. The human health effects to date are no different now than when the humidity was not poisoning us. So it's going to be fascinating to see how this changes as humidity becomes more of a problem in previously dry areas.
Do you think that there's an opportunity then for making better decisions around how a home is built or building materials that might be more humidity or water resistant? What are your thoughts on the built environment itself and the ways in which maybe it can be improved based on these climate challenges?
There are experts who know far more than me about building techniques. When I have been doing my stick-built housing building, I had drywall and asphalt shingles for roofing, and just tended to build on a crawl space, not understanding how moisture would penetrate a crawl space, and then moisture would penetrate upwards. Now we're going more to slab construction. We're looking more at building on a level area that is raised with respect to the surrounding area. Those nice pictures of your home in New Zealand showed perfectly a slab, and then add good drainage.
Yeah.
4 to 6 feet of diversion of water coming away from the sides. As we find out more, and the research basis that you're developing is so exciting, we'll be able to organize groups of professionals to pool data and speak not just what's going on in Pocomoke, which is very interesting to me, but might not be quite so interesting to someone in Florida or Maine or Wisconsin. Each will have particular sources of water intrusion, but remember the Red River Valley and the old songs you might be able to play your guitar to. Now we're playing to different songs, different music. Now we're playing to, how do I save my home after it's been flooded for 4 days? We know after 2 days, the house is likely to be unsafe in a flood event. But you're churning that around and saying you don't have to have floods to have flood-like results.
Yeah. Yeah, I think that's one of the biggest challenges is we've been primed to think about obvious water intrusion events, but potentially with climate change and growing humidity, people are at risk for microbial growth even without a specific intrusion event. And certainly we've been surprised even by the mixture of microbes that grow as a result of water intrusion and attendant risks beyond mold, including endotoxins and bacteria, that the stew that begins to develop can be quite harmful to the inhabitants' health. One of the great contributions that you've made, and it reflects the paper that we just wrote, is the recognition that in medicine for many years, and still to a large extent, the thought process is exposure to amplified microbial growth leads to either allergic responses, which are thought to be annoying but not harmful, and or pulmonary infections under the worst of circumstances. You uncovered a different set of immune responses that are inflammatory in nature. That, to me, paired with climate change, opens up the Pandora's box of public health and primary care issues. Can you talk for a minute or so just about that insight of inflammation and why it's become so important as a model for understanding how amplified microbial growth harms humans?
In the about 1970s in the U.S., there was a need for paint films to be staying away from walls. And the solution was to put a fungicide into paints, and mildewcides is sold as well. But we didn't know that the fungicides that were being used were mutagenic agents and made changes in microbial growth, specifically fungi. And they created mutant fungi that would make toxins where before they didn't. We're now looking at this same approach to mutation in normal ecosystems, and actinobacteria and gram-negative rods are doing things we never knew before. Actinos, once they get into a house, will look for areas that are alkaline in environment. Fungi look for an acidic environment. But meanwhile, the actinobacteria are attacking fungi by taking their acidic home and making it alkaline. And it does that because actinos are motile. They can move from room to room to room. And the bedroom and the closet and the master bedroom are notorious for harboring actinos where before they weren't there. So we're looking at differences in organisms. Years ago, beta glucans were known to be a problem, and yet it wasn't until recently, from some of your work, that we've been able to validate, fortunately, as a group, is that if we look at an actinobacteria, it will make a glucanase that will lyse the cell wall of a fungus and kill it. So we have chitin, we have mannans, and we have glucans. And we now have got to measure those and not just leave them out and ignored as they have been for so long. So this same change, possibly looking at cyanobacteria or blue-green algae, when they become able to grow on roofs and inside in wet areas in a home and a crawl space as well, we may be looking at what we know to be true in summertime along the eastern seaboard as well as in the western seaboard, is that actinos are not the only kinds of bacteria we worry about. Gram-negative rods like to have water saturation of 90%. So do cyanos. So in our urge to reduce indoor humidity, we have a number of enemies that will probably be trying to mutate along their own and share DNA from organism to organism. Marcons are notoriously promiscuous at sharing DNA, so that the problem that we can relate to moisture exposure is also going to say the problem of new organisms that we didn't have 15 years ago.
Yeah. Now, if there was one piece of advice that you could give someone in terms of improving the health of the home, given that climate change is happening and water events might occur and humidity is increasing, what's something simple that people can do as a prevention strategy to try and maintain a healthy home in this regard?
I think asking one question might be a little premature. We don't have the ecosystem nailed down well enough, I think, to make that one recording. But what we did when we had an outbreak of a dinoflagellate illness around the Chesapeake Bay called Pfiesteria was that we could pick up changes in visual contrast sensitivity. This is a non-invasive test. It takes 5 minutes. You cover one eye and look to see you can see where contrast diminishes with injury to the retina and injury to the systemic areas of the body. But it takes about 5 minutes to see, is there a fingerprint of a biotoxin that we can tell? It doesn't tell you what biotoxin it was, but if you are doing a 9-year-old group of students, you can start measuring what does VCS, as the short language you would use, what are we looking for? Do we have problems with VCS from cyanobacteria? Yes. How about fungi? Yes. How about gram-negative rods? Yes. How about actinos? Yes. How about recluse spiders? Well, yes for that too. But we're looking to see, is there evidence of changes of retinal perfusion, which means inflammatory sources in the retina are reducing blood flow, that we can pick up and say, this needs to be investigated further. So VCS is my number one. Do you have a different thought on that?
I do. And I think it's really just adjusting how we think about routine cleaning of the home. And if there was kind of one term that offered up an umbrella set of ideas, it would be the frame shift to what you and I call small particle cleaning. And that is to say, people need to learn the healthy habits and the tools and the techniques that we now know are better suited to reduce the microbial content and dust content in the home. And that sort of standard cleaning methods often don't achieve that same level of effectiveness. And the process isn't that much different than generally cleaning a home, but what you clean it with in terms of cleaning solutions and associated materials such as Swiffer cloths or other kinds of cloths, making sure that you keep your humidity under control, ideally somewhere between 40 and 50%, plus running special air filters that are beyond even just what HEPA does. I think there's sort of a constellation of decisions that people can make that will bode well for them in terms of creating a healthier home in general. And so the terminology that we use is called small particle cleaning. So if there was one thing I wish people would sort of adopt as a set of habits, it would learn more about that process and apply that to their home. It's easy to do and it's inexpensive, but it can make a big difference in sort of the safety of the home itself.
Do you think that we have reached the point of no return for water damaged buildings? Are we looking at climate change now being the cap the climax, so to speak, of making it impossible to find safe housing? Where can a person go on? Is there a website somewhere that would give comprehensive evaluation? You've gotten one coming out, don't you?
We do. So I think it is possible to create healthy homes even with climate change. We have a assessment tool now that we're putting into a digital form that helps people understand the risk of a home. We break that into 8 different categories and assign risk value to those 8 categories. It's one more tool, I think, among many that will offer a guide to people to better decide, is a home safe, but also what should they do about it if there are areas of the home that are not safe. There's a lot of work that needs to be done to better understand these pieces, and that includes elevating the training of investigators and remediators and other professionals in the home space, and then the work that I think you and I have really focused on, which is also educating practitioners on how to detect and treat these patients and prevent the recurrence. There's a big opportunity here, I think, within both the primary care and public health vein to make differences in outcomes that are meaningful. But I think that climate change creates an imperative that the whole set of professionals that inhabit this space improve our competencies in all aspects of what we do. This is only going to get worse, and it's only going to be a bigger problem worldwide. And so creating intervention tools and policy and guidelines will be critical for protecting the public.
I have witnessed the change in attitudes of the public towards folks with exposure to water damaged buildings. Back in the early 90s, GOMERs were what we called the folks who had many self-complaints, and get out of my emergency room was what the acronym was for. Now we're looking to acceptance of some of the tools that are transcriptomic or gene activated. Genie certainly is an easy way to find out the molecular biology of the illness. It's almost like you had to go through a battle of recognition to be accepted as a sick patient. Now we know, well, have you treated your hypometabolism yet? Have you taken care of specific causation yet? Have you taken care of the triple positives of Parkinson's that now have a prodrome that we can pick up in asymptomatic patients 4 years old? And you say, my God, if in Parkinson's, if you've got to wait 60 years before the prodrome turns into activity, what will happen when you fix the prodrome at age 4? Well, we don't know yet, and we're walking very, very quietly and slowly as well, because we don't know if we're going to be doing something wrong by fixing a gene abnormality before it's too late.
Right. That's right. Well, there's a lot of work to be done. I've always felt very privileged to do that academic work with you. I know there is plenty more ahead in that regard. And the paper that we just published on the 30 years of research as a summary is a benchmark. But also in some ways, there's a whole new phase coming ahead in terms of water damaged buildings and human health. So, Richie, thanks so much for spending this bit of time with me. And I hope this was very informative for people who'll be listening.
Have a nice afternoon, sir. It was good to see you.
You too.